Hello and welcome to the research conference of MSc Counseling, Bangalore University. My name is Saimah Shaikh and here is my research presentation. The topic of my research is Unveiling the Potential of Islam. It's a systematic review exploring the impact of Islamic interventions on mental health conditions. I have been looking into this topic since I submitted my research proposal back in March 2022. I hope I synthesize all knowledge to the best of my ability and do justice in explaining my research. Let us first get to know about the relevant research in this field. As all my fellow mental health practitioners would agree, every person comes into therapy with their unique individualistic self. This includes their spiritual beliefs, experiences, as well as their practices and values. For clients seeking therapy who place a huge amount of significance to their religion, mental health practitioners should be encouraged to incorporate religious context into therapeutic sessions. Research has shown that Islam identifies and acknowledges mental health conditions. However, it is upsetting to note that many Muslims do not seek psychotherapy due to the notion that their religious beliefs would not be acknowledged in the treatment plan. Even if they do consider professional help, research has shown that Muslims face difficulty in developing rapport and trust in the treatment process. Now, a common question that might occur to my audience could be, what kind of Islamic interventions are used in such kind of therapeutic approach? Let's look into the most three researched ones as follows. Quran. Quran is a holy book of Muslims that directs a believer to their way of life. Sunnah. Sunnah is a record passed on from generations about traditions and practices of the Prophet Muhammad, peace be upon him. And the next one is Hadith. It is narrations interpreted by scholars related to the Prophet's life and what he approved of in his life. Now comes the main question. What is the need for this research, Saimah? A recent study found a significant increase in Muslim population reporting an increase in the prevalence of psychological and mental health disorders. Therefore, this implies a desperate need for psychological interventions within this community. Also, there is a need for an approach to psychotherapy for Muslim clients where Islamic knowledge is considered into clinical practice. A recent study from 2022 found that Muslim clients view Islam as a framework to deal with their psychological issues. Therefore, they look for a treatment plan that complements their religious background in order to heal with mental disorders. Sadly, despite the increasing recognition of the role of Islam in mental health, there is a gap in learning how specific interventions of Quran, Sunnah, or Hadith can be incorporated in treating psychological diagnosis, and what could be the possible outcomes of such incorporation. Because of the lack of research gathering data to learn the recent trends in Islamic interventions, this systematic review aims to explore the empirical evidence of the effectiveness of Quran, Sunnah, or Hadith-based interventions in treatment of mental health disorders. This present research will investigate the design, application, and impact of Islamic interventions on mental health of Muslim participants. Therefore, the aim of my research is as follows. Firstly, to explore the variations in studies conducted using Islamic interventions, and through that process, I will answer my research question. What is the impact of using Islamic interventions on mental health outcomes on Muslims? And how does Muslim community interpret mental health in the context of Islam? Let's begin, shall we? Let me start by explaining how did I gather my data. So let's look into the methods section of my research. My systematic literature review followed a configurative approach to synthesize evidence from last 2 decades in exploring how Islamic interventions can influence mental health outcomes for Muslims. To follow proper procedure, I used PRISMA 2020 statement guidance and I explored the 7 mentioned databases. Next, what was the result of doing all of this? Using the exclusion and inclusion criteria for paper selection process, 753 papers were identified. out of which 82 papers were removed due to duplicate entries. 633 papers were removed in the title and abstract screening process. And lastly, 24 papers were excluded in the full text screening due to irrelevance to the aim of the current study, leaving us with 14 papers selected for this systematic review. Some of the selected papers specifically studied diagnosed participants. For example, anxiety using measurement scale of Hamilton Anxiety Rating Scale, Beck Anxiety Inventory, and Taylor's Manifest Anxiety Scale. Some studies focused specifically on depression, using measurement scale of Beck Depression Inventory 2, Geriatric Depression Scale, and Stern-Beck's Depression Scale. There was one study exploring depression, anxiety, and stress together. It was examined using depression, anxiety, and stress scale on their participants. While one study focused on participants diagnosed with dementia, all other studies explored understanding mental health from an Islamic perspective. Now that we've seen the study characteristics, let's learn more about the intervention characteristics used in the selected papers. Rasali et al. Investigated effectiveness of incorporating religious cultural psychotherapy based on the teachings of Quran and Hadith. Study from 2021 had their experimental group receive 15 sessions of educational religious classes on Islamic values and principles. Saget et al. Compared control group receiving 30 sessions of remembrance and seeking Allah's forgiveness intervention RSAFI based on Islamic values, morals, and concepts. One study developed religious commitment scales for Muslims to understand how Muslims view mental health in an Islamic perspective, while the next one used Muslim Daily Religiosity Assessment Scale to understand the scores of mudras relating to depression, anxiety, and stress. Study from 2022 assessed Muslims living in the United States with attitudes towards seeking professional psychological help scale to understand Muslims' perceived therapist characteristics and what were the preferences when seeking professional help. Whereas 5 of the selected studies specifically relied on Quran in their intervention process. Study in 2018 had their intervention group given 30 sessions of listening to Quran recitation in addition to speech sessions by Islamic scholar. The next 2 studies had their test group exposed to only Quran recitation 15 and 20 minutes respectively. Following a more specificity in Quran recitation, the next 2 studies selected one specific verse from the Quran, Surah Rahman, to monitor anxiety in pregnant women and managing depression respectively. After the intervention characteristics, we'll next see what were the treatment outcomes of using these Islamic interventions and how did these interventions influence the understanding of mental health in Muslim clients. The study using RCP showed significantly rapid improvement in reducing anxiety symptoms. Study conducted in 2010 found that Muslims prefer therapy involving guidance from Quran, Hadith, acts of Islamic religiosity. Participants gave importance to integrating services in mosques or community centers. Research supports that Muslims rely on Islam to cope with their mental health problems rather than seeking traditional mental health care or professional help. There was significant difference in mental health scores administered using SMHQ after having Quran sessions as intervention. Rafiq et al. Found Quran interventions helpful in mitigating depression as there were low scores noticed post-assessment. Intervention group listening to Quran showed reduced depressive symptoms and improved quality of life mean scores. Similar results were found reporting that Quran recitation caused reduced anxiety burden in pregnant women. It was found that Quran therapy sessions were effective and participants associated fasting, prayers, good Islamic deeds as cure from life problems. There was a positive influence in quality of mental health for participants receiving religious and spiritual education sessions. Participants from another study in 2021 showed preferences towards the use of Quran and Hadith texts. There was a negative correlation found between religiosity and depression and anxiety. Due to perceived Islamophobia in US, research concluded that Muslims living in US prefer therapists of similar background, mosque settings, Islamic community center, and imam collaboration in a therapeutic setting. Participants receiving RSAFI showed reduced anxiety in women and reduced depression in males. Lastly, among the selected studies, participants showed the use of Islam as a coping strategy for dealing with mental illness and spiritual distress. As can be interpreted through the summarization of results from the selected papers, Islamic interventions based on the beliefs and values of Muslims are more beneficial for the believing clients. Clearly, Muslims view mental health in the light of Islamic teachings, and they relate Islam to be a solution to overcome their distress. There is a social, cultural, and religious aspect, including how Muslims understand mental health, what are the desired therapist characteristics, what is the effect of Islamic interventions on treatment plans of anxiety, depression, stress, dementia, psychological distress, spiritual illness, and also quality of life. Let's see how are these findings relevant to current mental health practitioners. One of the selected studies found negative relationship between religiosity and anxiety, depression, and stress, meaning the more a person scores on a religious scale, the less they scored on the level of anxiety, depression, and stress. This implies that due to the preferences of Muslim clients for organizational religiosity, therapists can acknowledge such homework activities irrespective of the client's gender. Second et al. Concluded that participants receiving Islamic interventions showed lower scales on anxiety in women and depression in males. This should encourage therapists to include interventions like reading, listening, memorizing Quran, prayer acts of namaz, practicing in religious gatherings, and building one's knowledge of Islam by pursuing Islamic education qualifications into therapy. The use of Quran in therapy promotes tranquility and relaxation in patients suffering from anxiety and hence can be incorporated in therapeutic settings. Participants administered with RCB based on Quran and Hadith were noticed to gain more rapid improvement in reducing anxiety symptoms, and participants recorded regaining their spiritual resilience in dealing with mental health condition. Therefore, encouraging Muslim clients in following Quran, Hadith, and daily 5 prayers can help to get their anxiety symptoms in control, as prayer is a form of medication for relaxation and positivity. Pregnant women listened to Quran as a distraction technique and found that listening to Quran is helpful in relaxing a person and hence results in significant drop in depression level and improve quality of life. This implies that listening to Quran might be suggested by psychologists as a way to enhance mental health, achieving better relaxation and lessen depressive symptoms and achieve a good quality of life. Due to the preference of incorporating Islamic scholars, mental health practitioners can try including scholars in their group sessions and it might be insightful. As seen through research, client views Islamic deeds of fasting, praying, or other good deeds preaching of Islam as an alternative remedy for psychological distress. Therefore, encouraging such activities for client satisfaction can promote well-being for Muslims. For adults diagnosed with dementia, the use of Islamic books, lectures, Friday gatherings were a way of achieving well-being. But they view the reason for their disorder as a test, punishment, or gift from Allah. For mental health practitioners, it can be insightful to notice that clients coming into therapy may have such associated reasons for their illness. Therefore, an open perspective of free expression of thoughts can help build rapport and trust between the client and the counselor. Including faith healer for incorporation of Quran recitation, prayer, charity, mindfulness techniques, and confession with repentance of sin can be encouraged in current clinical practice. For Muslims in US, therapists of similar background, therapy in mosque settings, group therapy and imam collaboration was preferred. Therefore, openness to understanding the client's belief, practices, and preferences can be associated with a positive therapeutic experience for the client as well as the counselor. Since religious and spiritual education increased mental health scores and decreased depression and anxiety levels, promotion of religious and spiritual education for practicing counselors might be helpful. On the other hand, Muslims reported that faith acts as a protective factor against mental illness and they rely on Islam to cope with their mental health rather than seeking professional help. Hence, practitioners can work towards increasing their knowledge and understanding of Islamic beliefs, practices to better serve Muslim clients. Additionally, practitioners can work to create a more culturally sensitive and inclusive practice, such as offering Islamic friendly therapy options and providing resources for clients to connect with Muslim mental health professionals. It is important to view this systematic review under the light of strengths and possible limitations. It is worth noting that the present systematic review was conducted by a single researcher who personally identifies with Islam. This can be seen as a strength of the study as it allowed for a unique perspective and in depth knowledge of the Islamic interventions being reviewed. This review included only papers in English language, whereas Islam is a religion of Arabic language. Hence, many valuable studies might have been missed in contributing towards this study. However, the inclusion criteria was necessary to maintain consistency and quality in the study selection process. Although studies comparing Islamic interventions to other religious interventions were not included, this decision ensured a clear and focused analysis of the effectiveness of Islamic interventions without the potential confounding factors of other religious practices. Focusing solely on studies that specifically examined the effectiveness of Islamic interventions allowed for a more comprehensive and in depth exploration of the unique benefits and contributions of Islamic interventions for mental health treatment. This review aimed to focus on recent trends. It did not include studies from before 2002, and by focusing on recent studies, this review provides a current perspective on the effectiveness of Islamic interventions in mental health treatment. Even after following proper measures of PRISMA 2020 guidance, the present systematic review unintentionally included papers that presented positive outcomes for the use of Islamic interventions. Hence, it is a potential for publication bias. It is possible that studies with negative or insignificant results may not have been published, which can lead to an overestimation of the effectiveness of Islamic intervention. For future research, it is advised that more exploratory or experimental studies of individual and group therapy using Islamic interventions to be conducted. It is necessary to conduct additional longitudinal studies with a representative sample size. Such kind of investigations ought to have enough power to evidence changes in depression, stress, anxiety, substance abuse, and many other disorders that can be clinically significant. To conclude, this systematic review answered the research question by evidencing that Islamic interventions have a positive impact on mental health. Also, Muslims tend to view mental health in context of Islam and hope to find solutions within their religious preaching. Also, the following slides contains the reference list, and due to time constraints, I'll hold on to the slides for 2 seconds so that you can pause this YouTube video and look through the reference list and direct yourself to the ones that interests you. Thank you so much for listening to me and investing your valuable time in my talk. Please feel free to comment below your doubts, or you can directly email me on the email ID displayed on the screen. Don't forget there is a handout complementing my research presentation in the description below. Feel free to check that out too. Thanks a lot. Have a nice day. Bye.